Hey guys, welcome back. Today, I want to share with you tips on how to shrink and quickly zap angry zits. And these are really tips for you to use as more of like a backup emergency when you have those like angry zits that just happen to pop up last minute before like an important event, like a wedding or a party that you need to go to. Overall, these tips can be helpful in general for treating acne, but really is meant to kind of shrink those angry babies down last minute. And of course, if you are having really bad acne, as always, see your dermatologist. So red angry pimples, we've all experienced them, and for some individual like myself, they always seem to pop up right before an important event like my wedding. And if you have a few days before an important event, or you just have one that's like staring back at you in the mirror and it's just really uncomfortable and painful, try these tips. It will certainly help to shrink them down. Now, you obviously have to give it some time. There's really no great remedy that you can do on your own that's going to allow them to really magically shrink overnight. There are some things that your dermatologist can do, but certainly there's not a lot of things that you can really make them disappear overnight. So you want to be patient. With that, it means as much as you have the urge to, keep your hands off and try not to pick or pop your pimple, because even though that may seem really satisfying, trust me, it's going to get worse. It may lead to more inflammation and worse yet, scarring and infection. So keep your hands off. What you can do if you really feel like you have the urge, you want to pop something, is number one, if there's a pus bump on top of your acne, try some warm compresses. That's going to help to loosen up some of that fluctuant pus and will help to let it drain on its own. If it's just red and angry and painful and tender and warm, try some ice. And you can do this kind of like 10-20 minutes intermittently throughout the day. The icing and the warm compresses is going to help with the symptoms and also help to get them to heal a little bit faster. Now, the fastest thing that I find over the counter that's going to be effective, it does take a few days though, is to apply a leave-on benzoyl peroxide treatment. We know benzoyl peroxide is really great at fighting acne, the inflammatory component, bacteria that's on top of those red angry zits. And here, what I really recommend is, you guys know I'm obsessed with benzoyl peroxide cleansers, but here, unfortunately, the cleansers, due to the short contact time, is really not going to do too much. So here, you need to pick an acne spot treatment. And because benzoyl peroxide themselves can be very irritating, and some people might not even tolerate it very well or not be able to tolerate it at all. So here you just want to keep a few things in mind when you're selecting benzoyl peroxide. Go with the lowest concentration possible. So 2.5 to 5%. I would not use anything more than 5% because that can cause more irritation, more dryness, and some people will even experience what they call like a chemical burn from the benzoyl peroxide that lead to hyperpigmentation. So certainly if you are skin of color or you are sensitive skin, you may want to consider testing it on non-facial skin first, just to make sure that you don't react. There is a small group of individuals that have true allergies to benzoyl peroxide, and so certainly you want to avoid that if that is the case. The two products that I really recommend, number one, Neutrogena, their stubborn acne AM treatment. Now it says for AM, but you should use it more than once a day if you can. Twice a day, that can be helpful in drying up these zits a little bit more quickly. But I like this one because it's 2.5% micronized benzoyl peroxide. So the micronized just means that it's in a packaging system that delivers the benzoyl peroxide more effectively with less irritation. And so even though it's AM treatment, you can certainly just use this at night, or certainly you can use it twice a day. Another product I really like is from La Roche-Posay, their Effaclar Dual that contains 5.5% benzoyl peroxide along with lipohydroxy acid. This is slightly more irritating, but certainly with the lipohydroxy acid can work together to gently exfoliate and help with the inflammatory acne. Again, I recommend using it as more of a spot treatment. Also keep in mind that benzoyl peroxide, especially the leave-on treatment, can bleach towels, pillowcases, and t-shirts. So when you are using these spot treatments, just make sure you either switch your towels, your pillowcases especially, and your night, like your t-shirts, whatever you're wearing at night, to either white color, or you can purchase benzoyl peroxide resistant bed sheets and pillowcases as well, and towels. But just be aware that the leave-on product will bleach fabric. How I recommend applying these is to clean skin after cleansing in the morning and at night. Just apply a pea-sized amount, whatever you need to cover your pimple. Rub it in, let it dry, and then always make sure you follow it with a moisturizer and sunscreen in the morning. So that benzoyl peroxide is going to quickly shrink down the pimple, essentially dry out the zits. But if you are not able to tolerate spot treatment of benzoyl peroxide, then your next option would include an alternative like salicylic acid or even sulfur-based acne treatments. Now, these don't work as well and as fast as benzoyl peroxide, but certainly it's going to be more effective than not doing anything, right? So again, here, spot treatment for salicylic acid, there are plenty of them over the counter. One is the e.l.f. Acne Fighting Spot Gel, and this is really nice because literally it's like on a roller tip that you can just roll over your pimple, hands-free, pretty clean way of applying this treatment. You can kind of apply throughout the day, a couple times a day as well, and it's a gel formulation that dries fairly quickly. There's another one here from Tula that is 2% salicylic acid, another salicylic acid based gel product that you can use twice a day. And then I also have another one that I really like from e.l.f. as well. It's their Blemish Breakthrough line. This contains 1% salicylic acid and 4% niacinamide, and it's more of like a moisturizer cream. It's more gentle, so certainly if you have more sensitive skin, this may be a better option to either spot treat those pimples or even use it all over as a facial moisturizer for those who can tolerate it. So sulfur is another great anti-acne, anti-inflammatory, antimicrobial ingredient, and I wish there were more products over the counter that are available. I actually prescribe a ton of sulfur-based products for my rosacea patients as a prescription medication, but sulfur can also be used in different ways, like as a cleanser, but spot treatment can work similarly, and it may, like I said, is another alternative for those who cannot use or either is allergic to or just cannot tolerate benzoyl peroxide. The side effect of sulfur is, aside from that stinky, funky smell, is that it can also be just dry and irritating, as with most acne treatments, right? But the two that I really like is, one is from Vichy, and it's their Normaderm SOS Acne Spot Treatment, and that one contains 10% sulfur, as well as Naturium has an acne spot treatment that contains 8% sulfur, and those are fairly gentle that you can use, and I recommend using them like 2 to 3 times a day, just like how you would apply the salicylic acid or benzoyl peroxide. Apply on clean skin, a moisturizer afterwards, sunscreen if it's the morning, and that can certainly be helpful and is a good alternative to benzoyl peroxide. Now, as I mentioned earlier, you do not want to touch your face excessively. Avoid picking, manipulating, and popping your pimples. In addition to that, you also want to avoid being overly harsh with your skin and using ingredients that may actually cause more problem than good. What I mean by that is, you guys probably have seen on social media a lot of ways of potentially home remedies of treating your pimples, right? Like putting 70% alcohol on there, hydrogen peroxide, or even toothpaste. Those can be really irritating, even more so than some of these acne fighting ingredients. And worse yet, it can cause more irritation and hyperpigmentation. So I recommend just sticking to what we know works, like acne fighting ingredients that we know works. And then always, always, always make sure that you put on a moisturizer and sunscreen if it's the morning over these acne treatments to, number one, help to support and replenish your skin barrier and also reduce the irritation that these medications potentially can cause. Now, the other tip I really love is apply an acne patch on your pimple. This is great during the day and during the night when you're sleeping too. Great for if you have those like pus-like acne bumps. The patches are really great for drying out the pus bumps, and over time can also help reduce the redness, inflammation of just regular pimples as well. And these can be a great way in not only helping your pimples heal a little bit faster, but during the day, if you are in masks for some reason, whether it's work or school, the masks themselves can rub on your skin, rub on the acne, induce more inflammation and worsen the acne. So the acne patches are a great way to not only help your acne heal faster, but also protect your skin, your acne, from potentially getting worse. And then another trick that I really like to maybe add a little additional oomph to your acne patch is consider applying, a medication underneath it and then seal that in with an acne patch. Here, you really want to be careful. You either want to do 2 ways. Number one, stick with more gentle acne fighting ingredients. And what I mean by that is mostly salicylic acid based products. I find them to be a little bit more tolerable by most people than, say, benzoyl peroxide, because some people, like I said, benzoyl peroxide can really burn and cause hyperpigmentation in certain individuals. And so unless you tolerate benzoyl peroxide really well and doesn't really cause a lot of irritation on your skin, I recommend just sticking with like salicylic acid. You can apply that on your skin, let it dry fully, and then apply an acne patch over it. And that occlusion with the acne patch really help to dry the salicylic acid more effectively, and the acne patch on top of the salicylic acid can really expedite the healing process. Similarly, you can just look for acne patches that contain these active ingredients. I know Zit Sticker has quite a few of those with salicylic acid, niacinamide, and then one that I really like, it's more of like a acne patch, but it's really a drying patch is what they call it, is the Mario Badescu drying patch that contains salicylic acid and other ingredients like hyaluronic acid, niacinamide, and brightening with vitamin C that you put on your acne. And you can do this during the day or overnight, and that can over time really help with helping your zits heal a little bit faster. So putting this all together, if you want to use all of these products, you may wonder like, how should I go about doing all of this? Well, first and foremost, there's really no right or wrong way of applying these products, in the sense like there's really no difference whether you use these ingredients in the morning or at night or both. I think what you want to do is just figure out a method that's going to best be tolerated by your skin and that's going to work out for you, that fits into your day-to-day routine. For example, like if you know that you need to wear an acne patch in the morning because you want to protect your skin and reduce that friction because you have to wear a mask, for example, then you may want to say either just do an acne patch without any ingredients underneath it, or find an acne patch that have one of these active ingredients, and that's what you wear on your skin in the morning after cleansing. I certainly don't recommend putting on like benzoyl peroxide and then another acne patch. I think that's too much. However, what you could do is if you use your acne patch in the morning, at night you can consider applying a benzoyl peroxide treatment, and then let that be the kind of the treatment that you're going to really use at night. And so you're kind of really getting everything in, but just splitting them up by routine. You certainly don't have to use an acne patch if you don't need it. If you like say work from home and you really don't have a need to wear an acne patch, then you can certainly just spot treat with benzoyl peroxide or salicylic acid twice a day or even 3 times a day, and let that be your routine. The key here is to pick one of these ingredients or a couple of these ingredients and really just make sure that you split them up per routine so that you're not overdoing it. For example, you never really want to use salicylic acid and benzoyl peroxide in the same routine. That can just be too much. The other thing you want to consider, and you want to continue if you're already doing this, but definitely if you haven't, add in a topical retinol into your acne fighting regimen if you haven't been doing it already. Adapalene is what's over the counter, what's most effective, and it is not going to be the fastest or the most ideal in shrinking down your acne, but certainly can help prevent new acne. And for what it's worth, it does work fairly well with benzoyl peroxide, and here the benzoyl peroxide is not going to degrade the topical retinoid, right? Adapalene we know is very safe to use with Levon benzoyl peroxide. So certainly if you haven't, you can add that on into your nighttime routine as your overall acne fighting regimen to get a better handle on your acne in general. Now, if you are able to get in to see a dermatologist, which I highly recommend, there is a magical cortisone shot that your dermatologist can do that literally will melt your pimple away overnight. And so that is really the best acne emergency treatment that you can do. So like if you have a wedding coming up 2 days from now, and you have a raging pimple, certainly your dermatologist can shrink that. You may still have a little bit of post-acne marks, but that can easily be covered with makeup. And also like if you're really worried about breaking out before an important event and you still have like a good maybe couple weeks to a month before that important event, and you're able to talk to your dermatologist, get in to see your dermatologist, there are options your dermatologist can offer you that can maybe just kind of almost like preventatively help you minimize breakouts, whether that is prescription medications or like say oral medications or antibiotics. I have certainly done that for my patients just to get them through like an important period leading up to like an event. If not, these can certainly be helpful, but just understand that it's going to take some time. I would give it at least a few days to a week at the very least in doing this. So still great for those who are not able to get in to see a dermatologist or don't have access to a dermatologist. But that cortisone shot, I'll tell you, it burns like crazy when you're getting it, but it's so worth it. All right, guys, that is it on my quick tips for shrinking angry zits and pimples. I hope you find this video helpful. Comment below with what you've done in the past to really help with your acne, things you've tried as like a last minute emergency treatment, or if you would like me to go in depth and review any of these acne treatments I've mentioned. Again, I would love if you can give this video a thumbs up and subscribe to my channel, and I'll talk to you guys next time. Bye.